I was so good at my job of keeping time so well that now we have an abundance of time for questions. I don't know if that's a good thing or a bad thing, but we'll take it. So to the presenters, thank you all so much for sharing your knowledge and your information. There are microphones at your table, so you don't need to get up or move if you don't want to. I'll just invite folks in the audience to choose a side of the room where there are microphones. The session is being recorded, so we would like you to speak into the microphone if you're comfortable with that, to ask your question. Please don't all get up at once. There we go. That's good. We'll just go side to side.
Hello. Questions. Thanks for the presentation. My question is for Diane. I'm curious how you frame your program to the people that participate in the program. What we're realizing at Réseau is that there's an issue with how we frame our interventions. So we're finding that it's hard to get people interested in a program, but it's fun to get people invested in an evening or a dinner, you know? Like, do you refer to this as a program to participants, is basically my question, or how do you talk about it?
We talk about it as a program, but we really emphasize that that people can come on a Wednesday night at 5 o'clock, and you don't necessarily have to participate in anything. You can come and sit on the patio and read. You can come and just hang in the center if you like. Although there is kind of a process to the program. We have kind of a stretch and breathing group that starts right off, that also kind of is a place where people can greet newcomers to the program. We're not there to program people. We're not there to tell them what to do or to tell them they have to do anything. But it's just a time that's available to them in our center to do, and we offer all these things, and it's up to you to participate in whatever you like.
So it is a clinical program with clinical outcomes. We can evaluate it. Having said that, we dress it up and it looks like a social evening. So when you first come, you won't, I mean, they know it's a clinical program, but it doesn't feel that way, you know. We'll bring in occupational therapists, nurses, counselors. They're there, but we do it in a way that, again, that just feels like casual conversation. And the dinner, if you think about, like, the dinner itself feels like a dinner party as well. And so for many of these guys, 20, 30 years ago, hanging out and having a dinner party would have been a way of, you know, socializing. They're not doing that anymore. But at that dinner party, sitting beside them is the occupational therapist. Or talking across, you know, the table, they're talking about medication management and, you know, and how they deal with that. And so we manage all of that, but everything, it's really important for us, everything is opt-in. No one has to do anything ever. You know, that's our whole philosophy in all of our programs. You know, it's opt-in and they're low barriers. So we make it really easy for anyone to participate. Thank you.
And we'll go over here.
Thank you. Questions for Matt. For the Community Maximizers program, where does that funding come from?
Great question. Nowhere. No, I'm joking. My salary, no, terrible joke again. So initially it was from the AIDS Bureau of Ontario. That's where that funding came from, under program stream. But currently with our new PHAC funding under the alliance work that we're doing, Advance, I invite you all to come and see our panel tomorrow morning. So that's where we now take the funding. And now, yeah, it's a little bit more clearly defined under this funding. We have a lot more opportunities with our community leaders to really build capacity and also compensate them for the time and effort that they put into the projects.
Yeah, so. I think it's a really, really great program, and it really does help to mobilize community and actually get community doing what they need and what they want. So yeah. Congratulations.
Thank you. I really appreciate that.
Go ahead.
Again, thanks for the presentation this morning. They're wonderful. First of all, food is the only way to get anyone anywhere. My background is in food, and chocolate is a food group. Okay? Chocolate is a food group. My question is for Barbara. Is that correct?
Stephanie.
Sorry, Stephanie?
Very close.
Not even close. I suffer from sometimers. It's an aging thing that comes with HIV. I was just curious to know, where is it? The AIDS map that you mentioned. It was you who mentioned AIDS map?
I did mention it, yeah.
Mind map, my apologies.
Mind map,
Mind
sorry,
map.
not AIDS. Yes,
now, is that a provincial study, or is that looking at a national piece?
So I am not actually working on
I
that
know,
one.
someone
It's
else was.
Travis, who's here, and maybe he can answer that question for you. He's just right there. Yeah.
It will eventually be provincial. At the moment, it's just the Lower Mainland. We're piloting it in the next year.
Perfect, okay. And I'm going to take advantage of having the microphone and ask 2 questions, if that's okay. And if it's not too bad, I'm doing it anyway. Who was it? For Max. For Matt, sorry, at Max Ottawa. You spoke about the interventions in the micro grant program. Is it all intervention based? And from what I saw you present, I probably answered my own question. It's not. It sounds like it's broad based and really speaks to community need or want rather than
How you define it depends on how you define interventions and how you look at research and yeah, I guess but it is peer-led, community-based, and any idea that comes to us is usually something that is considered. So, yeah, so some of them could be interventions, some of them not. It just really depends how you loosely define that term, I would say. Yeah.
Totally. Work the words, absolutely. Okay, thank you, everyone.
Hi, this could be answered by any of you. Sort of a bit of a broad question, but have your organizations had participants in your program where they then become more involved with that organization on a volunteer or an employee or just a more involved level? And is that specific criteria and a component of evaluating and reporting in terms of reporting for, you know, whatever the metrics are that would use as to try and gauge whether the program is working? Is that greater involvement tracked and reported?
Maybe I can start. So I'm going to contextualize this again in our region and in where we're coming from. We're a very young organization. We're growing at a rapid pace. So obviously we've seen a lot of, you know, leaders that have then become volunteers, that have then become staff. So we are seeing a lot of that retention and a lot of people kind of like sticking around. Do we evaluate that in terms of like in how you're framing it? No, but I think that's an opportunity and I will bring that back. Thank you.
At Health Initiative for Men, I think that's really one of our values is that we engage volunteers. We've probably got, I think, between 150 and 200 active volunteers, and one of our goals in terms of engaging with volunteers is really building that community capacity. So I mean, you can look at our staff list, and I would imagine that at least 50% of our staff come from originally being a volunteer within the organization, and then playing more of a leadership role, and then being hired as a staff person. I don't think that we evaluate it in any kind of formal way, but because it is really one of our values in terms of what we believe in terms of the volunteering being capacity building, we do report that back to our stakeholders in kind of very broad terms.
Yeah, and we have 2 different types. One, we've got general volunteers who work at the center, and we have a fairly robust volunteer program, and they can work in all different aspects of it. And we have what we would call peer collaborators, especially on, we've done quite a few research projects at the center, and they would be involved in the most part on those parts. And we do see the peer collaborators as staff. They're basically, when they're working in that capacity, they're staff. And when they come to the center, not in that capacity, they're participants. None of those, to the best of my knowledge, have morphed into a full-time position, and we haven't really looked or evaluated that.
Actually, one of the considerations as we have this happening is that we want to support people in development and taking on responsibility and moving forward. We also want to remain as their healthcare provider, and so it's kind of a fine line sometimes of wanting somebody to who is getting well. You want them to launch. You want them to get out there, but we also want to be their fallback too. So we kind of tread that kind of easily.
My turn. Hello. Marc-André Leblanc from Gatineau/Ottawa/National Capital Region. So really closely related to the idea of mental health is the idea of social health. And full disclosure, I'm working with Max Ottawa as a consultant, developing their strategic plan. We just did a whole bunch of focus groups and interviews and surveys, and that came up top of list in terms of people's concerns, was mental health, but really strongly interlinked with social health. And I was struck by the number of Maximizer projects that are creating social spaces for people to just come together, including cooking. You mentioned the importance of offering a meal, people coming in, dropping in, maybe reading. And I know that in a recent discussion with the staff and board at Max at a strategic planning session we had recently, the issue came up that as a result of some of the success of these programs from Max, guys are just now dropping into the Max office just to hang out. Like there's a desire for social space outside of the bar scene, off of our devices, where we can connect with each other in a social way, share a meal, talk, have coffee. So I'm just wondering sort of what your experiences have been in some of the discussions about creating those social spaces, because there's a need there, and how it links so strongly with the idea of mental health for our communities. Or for that matter, anyone else in the room, I'd love to hear, because I'm sure it's an issue around the country.
Well, I'll just jump in, because I think you raise a really good point. I think the idea of having social spaces and social connection is huge. We're hearing that all the time. Isolation is a huge issue. Having said that, the way that, at least with our organization, a lot of it goes back to funding. Our funding model is that our key contracts with the Vancouver Coastal Health are based more on clinical outcomes. So we're not funded to create social spaces. We do raise about $1 to $1.2 million on our own that we can spend any way we want, and a lot of that is used for creating that type of stuff. So, for example, additional food, we were funded for 1 meal, we serve 2 in our day program. We do art therapy, recreational therapy, and music therapy, because we found for us, we need to have some sort of, for our clients during the day, we need a social space that actually gives them something to do. You know what I mean? Like just coming and hanging out. We've also got nap rooms, like literally nap rooms. So you can come and nap, you can come and sleep anywhere you want, you can lie on top of the therapy dogs, you know, you can do kind of all of that stuff, and that sometimes is just social. But yeah, so I think that's a huge component. Now again, we're working with clients that I would say are pretty extreme. You know, our clients are, you know, they've got a lot of comorbidities and they're not well, you know, all of them. But in general, I agree 100% that social space outside of the bar scene is really needed.
So I'll speak to that a little bit too. I mean, Health Initiative, we're also funded by Vancouver Coastal. We get about 60% of our funding from Vancouver Coastal Health right now. And I think one of the things that has made this relationship really unique is that we have been able to, VCH has given us permission to kind of look at gay men's health from a really broad perspective. While I think Misty spoke about the funding envelope being the Stop HIV funding, so it has an HIV focus, but we've been really appreciative of VCH's kind of understanding that an integrated gay men's health approach or integrated health approach really looks at like the social drivers, the physical drivers, and the mental health drivers around sexual health, and we are funded to provide social spaces and develop social groups. So that's actually one of the areas that we continue to work in, and I'll speak to I think the evidence of the need. We've just completed a community survey to help inform our strategic planning process, and we got almost 500 responses, and I did just a kind of a preliminary review of the data, and I was not surprised, but surprised at just the number of people that spoke to the need for social spaces. And I know that in the development of our priorities for our next 5-year strategic plan, we'll be looking at that and trying to figure out how to address that really strong need that we're hearing from the community to develop these safe and accommodating social spaces.
I have something a little bit related. It's not quite the same, but not so much about social space, but more about like a health space, and in terms of using a space in a different way than it was intended. So what we heard from some clinicians was that people were coming to the STI clinic not necessarily for an STI check, but they were coming because they didn't have anywhere else to go, because they didn't have an MSP card. They're new immigrants, they don't know where to go. And so they were using the STI clinic slightly in a different way than other people that were there. And so I guess that speaks to using these spaces in multiple ways.
Fantastic. Are there any other questions? Go right ahead.
Hi, my name is Philip, and I just want to comment on the social aspect, because I think one of the things I think is really important, there's no question, and we've been hearing that forever. I think there's a challenge that we need to be careful of, I think, which is to not sort of make socializing and creating that space a not-for-profit job. Meaning not-for-profits can support that, but I think not-for-profits and institutions can also stimulate people thinking about how to socialize in different spaces and to use spaces that exist. Because one of the things that I see a lot more now is that there's this expectation that these social spaces are created for people in the absence of these commercial spaces that maybe people could go into before bars, etc. And I wonder how you can, I think about maximizers as a way of encouraging the creation of social spaces, but also not relying on, because funding, right? Like there are opportunities for people to get together without having to rely on funding. There are spaces that people can access without having to be, go through gatekeepers. And so I guess I would just sort of say, how do we find the balance between supporting social spaces, especially for folks who may be more, may face certain barriers to accessing social spaces for any number of reasons, but to not necessarily try to corner the market and become gatekeepers for social space.
All right. It's a fantastic conversation with 2 minutes to spare. So I just want to thank you all for attending. I want to thank all of our presenters. Let's give them a round of applause. And while I know this was your favorite part of the day, your second favorite part of the day, called lunch, starts in 2 minutes. So I'd invite you all to nourish yourselves, stretch your legs, and enjoy the rest of your summit. Thank you.